When I think about dealing with the disease, someone has to fight for you. And if it's not yourself, then you're going to struggle. So you need to be your own advocate. In being your own advocate, you have to have a plan, because you'll be going around in circles. So I know that this is what I'm going to be doing today. This is what I'm expected to be doing next month, next year. And if things change with my physical health, I know what the doctor has planned for me down the road.
You've got to commit time and resources, and you've got to put your strength and your soul and your heart into it, or you're not going to make it.
I ran into a couple of doctors in the beginning that they may have been very skillful as a surgeon or an oncologist or whatever if it was regular cancer, but I didn't have regular cancer. This is an irregular cancer. I don't know any other way to say it except that it's just not the run of the mill. And if you don't have somebody who's familiar with it, you may not be getting the best treatment.
Well, one of the things that's important to do when you have neuroendocrine tumor is to assemble the team of professionals that you're the most comfortable with. So you have to have an oncologist, or maybe 2 or 3 in my case. I have a cardiologist. I have a gastroenterologist. I have a primary care physician. I think there's probably a few others I can't remember. And you not only have these assembled in your mind, but you have it on paper. And when you go see a doctor, even if you have to go see a new doctor, you take that piece of paper with you so the doctor knows who to send his notes to, who he needs to talk to, and who else is involved. And that helps them, it helps you, and it also shows the doctor that you're pretty serious about, your treatment and your disease.
There are doctors who specialize in this disease. There are facilities who specialize in treating this disease. So it behooves you to find a specialist, someone who knows, someone who cares about what's going on in your body and in your life, and that can devote the time and attention to it.
For me, my health now comes first. Everything else comes second. And that was the decision that I had to make. And there are some consequences that go along with that, but it's how I've chosen to live my life.
Once you find out that you have cancer, the best thing, or the best advice you can give yourself, is to keep a positive attitude.
I think one of the big things I've learned is that if you're willing to do what's necessary, if you're willing to submit to the treatments and not be afraid of them, that there is hope.
The most important thing for somebody who's recently diagnosed is don't be afraid. It's not the end of the world. You can enjoy yourself, you can enjoy life, and you can enjoy your family.
My advice, if you have carcinoid cancer, find some answers, find some direction, be positive, and go for it.
But I've got 3 scans that are clear, and who knows how many more. And you know what? Even if it comes back, I've had this much more time, and it's been good time, and I'm going to make the very best of what I've got left.
In the future, beyond today, I've got a couple more trips I want to do. Since I've been diagnosed with carcinoid, I've been, I guess, kind of adventurous. My wife says I've been taking her on trips to try and kill her. We did a 5-day raft trip down the Rogue River in Oregon. We went on one vacation there. We did zip lining and rented ATVs.
Well, I think for me there's a lot less uncertainty than there used to be. I feel now that I have control of my disease. It's been almost 5 years now since diagnosis, and I have recovered 90% from where I once was.
Have 4 grandchildren and 1 on the way, So I do a lot of traveling, helping my children and grandchildren, and involved in the community, and my life has gone on. And I have no complaints. My family doctor that I originally had gone to in my home community had said, I have one other patient out of my whole practice that has carcinoid cancer, and you would be the last person I would think that would have cancer.
I woke up from my drug-induced sleep after the surgery, and I told the surgeon when he came in, I know what I'm supposed to do. I'm supposed to tell people about this cancer. I'm supposed to educate people about this cancer. And, you know, he's kind of patting me on the head. And now, of course, he's seeing that I am doing some of that. In fact, it's almost come to pass, as a matter of fact.
I keep track of my disease by reading my own test reports. I read my own CT scan results. I read my own MRIs. If there's a term I don't understand, I look it up.
Being Santa Claus is a lot of fun for me. It's fun having the kids and doing that kind of stuff and seeing some of the changes and the surprise on their face and the parents and the whole thing. I really enjoy that.